Greetings from Perham Health. I'm Chuck Hophius, the Chief Executive Officer, and I'm here to talk to you about three things. The rising numbers of COVID in our community, what we're seeing right here at Perham Health, and how you can help us each day. I have four graphs that I'd like to just show you quickly. The graphs that we're following to see what's happening with COVID in our community. The first one is the 14-day case rate for Otter Tail County. This is the number of people per 10,000 population that public health in our county has followed positive for COVID-19. All summer long, it was around 5 people per 10,000 population, which is about what you want to see to make sure you have a pandemic or an illness under control. And then when you came to fall, you started seeing that number rise. It started rising to 10, to 20, to 30. And then the most recent, we were at 119. Anything over 50 is alarming. And our most recent was 119, and the one expected to come out today is 170. I'm really concerned about the number, but I'm more concerned about that rapid growth rate that we're seeing. The second graph is the 14-day positivity rate for the county. Of all the tests done in the county, how many now are coming back positive? Again, you want to see under about 5% to make sure that a pandemic is under control. And we were able to sustain that all summer long. And then that started jumping. And a positivity rate, if it gets over 5% to 5 to 10, then you're in that real area of concern. And when it gets over 10%, then it's more alarming. And so in this fall, we started getting into that 5 to 10% rate. And now through the month of November, we're over 10%. The most recent you can see is almost 16%. Again, that growth rate is alarming. The next graph is a Perham Health specific graph. We kind of track how long does it take us to get 25 positive cases here at Perham Health. And in the beginning, it took us 154 days. So long that I didn't even put it on the graph because it skews it off the chart. And then it became 40 by September, and then 15, and then 7, and then lower. And now we have 25 cases every 1 to 2 days. We have that many in 1 day, or at least a day and a half. We have 25 cases. Again, that growth rate is alarming. The last one is our own positivity rate. What are we seeing here at Perham Health? How many of our tests that we're running come back positive? Now, our rate is going to be higher than the county, which is natural because we're generally dealing with sick people. And all the county numbers include large groups of asymptomatic people, like a nursing home or assisted living that might be getting tested, or when the Fergus Falls Armory did their testing. They're testing bigger groups of asymptomatic, so their numbers should be smaller. But still, all summer long, we saw a 5% positivity rate. And the county's was just over 3. So that would be a pretty typical difference, which I just explained. But our rate started really jumping in September to 10, to 15, to 20, to 30. And right now, for the last 14 days, our positivity rate has been 35%. More than 1 in 3 people that we test are coming back positive. More than 1 in 3. Again, that growth rate is alarming. The staff here at Perham Health are part of our community. You see them in the grocery store, in your church, in your social circles. And so there's no way you can have that kind of positivity growth rate without our staff being affected. And that's exactly what's happening. Every day we have many staff out with COVID, COVID symptoms, family members with COVID, or out because their kids are home from school and need care because a classmate might have COVID, or now distance learning. And so we can't maintain this level of growth rate and be able to care for our community because our staff are being affected. And the thing about this virus is it's easy to control. It's not difficult. And you've been asked all along to do 3 things. To mask when you're indoors or can't maintain 6-foot social distance. To maintain that 6-foot social distance whenever you can. And to wash your hands and sanitize the high-touch surfaces around you. And I really feel it's unfortunate that this happened during an election year because it got all mixed up in politics. And it got all skewed on social media. And normally, healthcare is not a political agenda. Normally, healthcare is one of those things that pull us together. It's not red or blue. It's not urban or rural. It's not the things that tend to divide us. It's one of the things that tend to pull everybody together because we all want good healthcare. And the other thing is the science is clear. There's debate on social media. There isn't debate in our healthcare community. Masking is very effective. We have been using this much longer than I've been in this field. When you come for surgery, that group is gowned and masked and face shielded, not for their own protection. That provides a little protection for the staff. It provides a lot of protection for the patient from an illness we might have, a virus, a bacteria, any kind of germs out there. That's why we mask when you come into our building. So we know it's effective. And the longer we've been at this, every month a new study comes out showing that when one person masks, it's pretty darn effective. And when both people mask, it's amazingly effective. And so we need people to follow those masks, to wear the masks, to social distance, and to sanitize. What I'm asking you today is to think about your elderly mother, grandmother, or aunt, and not what COVID can do to you, but getting COVID to that person. They're in a very high rate of chance of dying with COVID, a very high chance of getting permanent complications because of COVID. I'm asking you to think about that single mom down the road who now has to keep her kids at home because the school is in distance learning. And she may have to choose between their only income she has and caring for her kids and educating her kids because this pandemic is so out of control at the moment. I'm asking you to think about your buddy who now gets COVID and has to be home at least 14 days, longer if he has any complications. And he may not have the sick leave. He may not be able to pay his family bills during that time. And I'm asking you to think about our healthcare workers. I am so proud of the Perham Health staff, the Perham Living staff. We have amazing nurses and doctors and CNAs and so many other caregivers caring for you, caring for me, caring for the community that we serve. And they're doing it in just an amazing way. But they're tired. They're working extra shifts. They're working double shift illnesses. They're giving a lot of time away from their family to care for our community. And I need you to show your appreciation, to show your respect for that staff by doing the things that people have been asking. We have it within our control. I'm asking you to show this amazing staff appreciation by wearing your mask, by social distancing, and by cleaning and sanitizing whenever you can. Hope is on the horizon. We've just seen two really great studies showing that the new vaccines that are coming out are not only highly effective, but highly safe. We expect by year end, healthcare workers are going to be able to start getting that vaccine. We expect by March, the general community will be able to start getting that vaccine. And that maybe by next summer, things will start to get back to control. So hope is on the horizon. But right now, we are in the peak of this pandemic. It's getting worse for the next several weeks. And the only way to bring it under control is to do those three very simple, very effective things. So please do this for your community. Do this for your neighbors. Do this for our hardworking healthcare workers. And hopefully we'll all have a great 2021. Thank you.